that the patient will present with hematuria and hemoptysis. So there is kidney and lungs involvement. Okay, so it's always easy for me personally speaking, it's easy for me to make a Goodpasture syndrome diagnosis, and just remember it's hypersensitivity type 2. So moving on, we have type 2, right? So type 1 was linear immunofluorescence, and type 2 is granular, which is basically PSGN, being progressed into rapidly progressive, and then or it's also diffuse proliferative that we'll discuss later on. And then there is type 3. Type 3 is basically the one with like negative immunofluorescence, which is also called posse immune, and we have done this in like the when we studied the vasculitis. It's basically the Wagner Wagner granulomatosis, yeah, granulomatosis with polyangiitis. So I don't know if you guys remember, but the sketch from like the Pathoma, that this involves nasal symptoms and lungs and then kidneys. So for kidneys, you need to know that there is nephritic syndrome going on, and with these, you basically come to the diagnosis of granulomatosis with polyangiitis. I'm so sorry. And the other example is MPO, which honestly we have discussed in class 4 under the vasculitis topic. Moving on, we have the diffuse proliferative glomerulonephritis. So it's actually pretty simple. It's basically SLE patient, which will be presenting to you with like hematuria or nephritic syndrome symptoms. So for SLE, just remember the patient can present with rash or pain. You can go into the MSK section and then learn like what this is. Basically, it's a malar discoid rash, it's arthritis, serositis, hematological disturbances, and stuff like that. You can just go through it in MSK. So for this, it's easy to learn that SLE basically has the the anti-DNA antibodies, anti-Smith antibodies. So you just need to remember that. And I don't know, I learned it like SLE, so L looping. So there's basically wire looping, as in lupus. So wire lupus, so wire looping of capillaries on the light microscopy. And there's also IgG based immune complex deposition, and C3 can be low. So next, So next we have Alport syndrome and membranoproliferative glomerulonephritis. So the Alport syndrome, as is very much obvious that it's a syndrome. So it's gonna involve your can't see, can't pee, can't hear a B, right? So it's basically your eyes, your kidney, that's the nephritic syndrome, right? And then can hear be your basically ears. So you can read it over here. It's sensory neural hearing loss, retinopathy, anterior lenticonus, and then glomerulonephritis. So for Alport syndrome, I don't know, I just learned it like on a port, it's Alport. So on a port, you're going for a picnic, and in a picnic you like take a basket, so it has basket weave appearance on the electron microscopy. This one, although it's not really tested that much, I'm not sure. Then we have membranoproliferative. Membranoproliferative can be type 1 or type 2. It's similar to rapidly progressive, so it's basically a combination. Type 1 is mostly because of a hepatitis B or C virus, and type 2 is mainly associated with C3 nephritic factor. Yeah, that's pretty much it. And there's immune complex deposition and tram track appearance, and again, it's not really tested that much, but this is all about nephritic syndrome.